welcome to our show, Health and Wellness, Myth versus Facts. I'm Gargi Rawat. Now, the definition of health goes way beyond the absence of disease. The pandemic has put mental as well as physical health and wellness into sharp focus. Awareness of health issues is important for visibility in community. The absence, inaccessibility or inaccuracy of information about chronic illness causes a lack of knowledge, which is worsened by myths and fear as well as increased social media trust. Diabetes and heart disease both are leading causes of death in India. Relatively younger adults are getting diagnosed with these serious diseases. Both these chronic illnesses have substantial complications, and it's easier to manage the disease if you're aware of the warning signals and problems associated with these conditions. Expert advice will help our viewers gain correct information and also act accordingly and be prepared in case of any untoward incident. Well, let's go across now to our panel of doctors. We're joined by Dr. Mayur Agrawal, founder and director, Hormone India, Bhopal, and Dr. Sunil Beniwal, interventional cardiologist, Rukmani Birla Hospital, Jaipur. Thank you so much, doctors, for taking time out and joining us on the program to answer all our questions. Dr. Mayur, first to you. Diabetes causes multiple complications affecting almost every body part. So, do these complications start showing their effect immediately after getting detected with diabetes, or do they manifest at a later date?
Okay, so diabetes complication can be basically divided into two things: microvascular and macrovascular. Micro is like the small vessel damage, and macro is the large vessel damage. So for microvascular, you have neuropathy, retinopathy, and nephropathy. Similarly, for macro, you have this heart attack and stroke and peripheral arterial disease. So these can present at any time, right? Even at the diagnosis also they can present. Sometimes even the patient presents with the complication and later on we diagnose him with diabetes. It all depends on the duration of the diabetes and the glycemic control when the complication develops. And also, like sometimes the complications are at starting and sometimes it is during the course. So there are specific guidelines that when we should screen for which complications.
Dr. Mayur Agrawal, the complications of all diabetes, if you could tell us about them, are they the same or is there a variation of the severity of complications and depending on the type of diabetes?
Yeah, so this is really a nice question. Diabetes is like increase in the blood sugar, but there are various type of diabetes and accordingly complication may be different. Okay, so most of the people would be knowing only about type 1 diabetes and type 2 diabetes. So in type 1 diabetes, which usually occurs in young people, so in that decade, diabetic ketoacidosis is more common. It's an autoimmune condition. So other autoimmune complication or other autoimmune conditions would be more common. Similarly, type 2 diabetes would be more common at a later age. So that geriatric problem would be more in them. Also, they are obese. So obesity related are more common diseases in them. Then HHS, hyperosmolar coma, is more common in type 2 diabetes. Other than type 1 and type 2, there are various type of diabetes, like pancreatic diabetes. So in those patients, pancreatic cancer would be more common. Similarly, we have GDM, that is gestational diabetes mellitus, the diabetes which happens in pregnancy. So in that, the baby would be affected. The baby would be big, that is macrosomic baby. Then there are other complications in the pregnancy. Then there are various other types of secondary diabetes. Okay, something like that diabetes, that the sugar raise is due to some other hormone, say like Cushing's disease, where the cortisol hormone is raised. Okay, or acromegaly, where the growth hormone is raised. So these are secondary diabetes and their complication would be different, their presentation would be different, and their treatment would be different. So this all comes under endocrinology. So these are something which should be taken care of.
All right, now we can go across to Dr. Sunil Beniwal as well. And Doctor, cardiovascular diseases are the leading cause of death worldwide, and they're also one of the most expensive diseases. So as we asked you earlier, which are the diseases that are preventable and which can't be prevented?
Yeah, very good afternoon to everyone. And yes, you are right. Cardiovascular disease is the leading cause of the death worldwide, and nearly 30% of the human deaths are caused by the cardiovascular diseases. I'm not agree with the second thing. It is nowadays the treatment of the cardiovascular disease are very affordable, and it is covered in many national schemes also, like Ayushman scheme. About the preventive aspect, most common cause of the cardiovascular disease are the coronary artery disease, and it is quite prevalent and the cause of the most of the human deaths. So coronary artery disease is a preventable one, and we can identify our risk factor through going through the preventive health checkups in various hospitals. once you identify that we have hypertension, diabetes, what risk factor, we should control our risk factors, and by this means we can prevent our coronary artery disease. Some diseases like congenital heart disease, disease related to the age like degenerative valvular disease are not preventable. But the most chunk is coronary artery disease, which is preventable.
All right, so you're saying that you don't think it's one of the most expensive diseases. If you could talk more about that you feel that the costs have really come down over the last couple of years and decades?
Yeah, over the last decades, the treatment of the coronary artery disease, which is the most common disease worldwide and needs in emergency treatment also, the treatment comes down very less and covered in many schemes like the Pradhan Mantri Yojana Ayushman scheme. It is treated free of cost in many hospitals also. So it is not the newer technology what coming into the latest technology definitely has some expenses for its own, but for the common treatment of the cardiac elements are now very cheap and very affordable.
All right, doctor. So when we talk about heart damage or heart disease, it can be various types and have different causes. A defect in heart valve also can cause heart failure. If you could tell us more about that, are all heart valve problems congenital?
Heart valve is a very important structure in our heart. It helps our heart to keep flow blood in one direction only. It helps to avoid the backflow, so the heart keep functioning. Abnormal functioning there are 4 valves in our heart. Abnormal functioning of any of the heart valves can lead to the heart failure or improper functioning of our heart. The causes of the heart valve disease are various. The most common cause still in India is rheumatic heart disease, and rheumatic heart disease is caused by a bacteria, and if we diagnose the rheumatic fever timely, it is quite preventable also. So in children, if we can diagnose the rheumatic fever and treat them accordingly, the rheumatic heart disease can be prevented. Other causes like you mentioned, the congenital heart disease is patient have we have some causes of the congenital heart valve disease, but they are very rare and they are treated also. There are also a treatment available for these things. Some disease may be related to the age, or an elderly age population, the heart valve get degenerated and they have some improper functioning of these heart valves. So these are quite not preventable. But the commonest cause is rheumatic heart disease in India is quite preventable.
All right. Well, let's now come back to talk about diabetes. And Dr. Agrawal, what happens to a person with advanced diabetic neuropathy? What are the ways to manage it and can it be prevented?
Yeah, so really nice question, and it is very relevant for our listeners. So this is again a microvascular disease, microvascular complication. The nerves, the blood supplying that nerve is damaged. Okay, so that nerves are damaged. And when nerves are damaged, the patient will have symptoms like tingling, burning, feet, and all numbness. Those type of symptoms these patients would be having. Also, if these nerves are damaged in GI system, that is our digestion part, then the patient can have nausea, vomiting, diarrhea. There can be incontinence of the stools or constipation also. All these things can be there. Erectile dysfunction, sexual dysfunction. So these are all neuropathic symptoms. And patients sometimes do present directly with these neuropathic symptoms. And for the next part of the question, which is more relevant, that can it be prevented? Actually, it can be prevented very well with the glycemic control. If you follow the diet, if you follow the medicine, if you see your doctor, you follow them, you have a proper visit, all those things you are properly following, then it is very well prevented. And in fact, it is better prevented than treated, because the nerves which are damaged may be irreversibly damaged. In fact, most of the time they are irreversibly damaged. So it is better to prevent than to treat.
All right, and that's something you doctors always say, prevention better than the cure. Dr. Beniwal, if we can talk about atrial fibrillation, which is a commonly reported heart rhythm problem, if you could explain what exactly is it and what causes it?
Yeah. Normally our heartbeat is controlled by the sinus node. There is one structure called a sinus node. So normally our heartbeat is controlled by sinus node, and we call it a sinus rhythm. So instead of the sinus rhythm, if there are our heartbeat generates from the multiple sites in the upper chamber of the heart. So and when it arises from the multiple sites, then it becomes suddenly increased and it become irregular also. So this condition is called atrial fibrillation. The patient feels palpitation once the heartbeat increase, or sometimes they may feel shortness of breath or some dizziness kind of thing. So this is atrial fibrillation, and it is quite common in the elderly population. The risk with the atrial fibrillation is that atrial fibrillation can cause stroke. Stroke is a permanent disability. One side may not work. So the biggest disadvantage of having atrial fibrillation is that there is a very high chance of having stroke. So we have to treat this atrial fibrillation rhythm also, and we also prevent the stroke also in that condition. About the causes of the atrial fibrillation, there are various causes. The most common cause in our setting is hypertension, but not only the hypertension, any disease which can affect the functioning of the heart can cause atrial fibrillation. Other than hypertension, diabetes, thyroid disorders, weakness of our heart, valvular heart disease, coronary artery disease, all these can cause atrial fibrillation. Many times there is not any reason, and we call this a lone atrial fibrillation. So lone atrial fibrillation is without any cause, but these are the common cause for the atrial fibrillation.
All right. Well, thank you, doctors, for answering those questions. We'll slip into a short break and come back for more on how to manage your health. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about managing diabetes and heart disease. Let's go across to our doctors. And Dr. Mayur Agrawal, if you could tell us, people with diabetes were seen to be adversely affected by COVID infection. Are people with diabetes more prone to getting all infections?
Yeah, so now during COVID, we have seen that those patients who have diabetes, especially with uncontrolled diabetes, they had this COVID infection more severe. And we have evidence that almost every infection is more severe in diabetic patients, especially about the skin, bone infection, joint infection, sepsis. All these are more common in diabetic patients. Also, their severity is more in the uncontrolled diabetes. Also, if these infections are there in these diabetic patients, then their hospitalization, their admission rate is more. And as these patients already have some comorbidities, like they may be having neuropathy complication of diabetes, then they are more prone for this foot ulcer, and they may have kidney disease. Then again, they are more prone for infection, heart failure. So definitely diabetes, especially poorly controlled diabetes with a long-standing poorly controlled diabetes, they are at risk of infection.
All right. Dr. Beniwal, in a developing country like ours, anemia is very common. Is there a link between anemia and heart failure?
Yeah, that's true. Anemia is a very important problem in India, especially in the ladies. There may not be direct link between the anemia and heart failure, but the blood in our body, heart and lungs, there are three systems work for the same purpose in our body. The purpose is that they deliver oxygen to each and every cell of our body. So our lungs get oxygen, that they dissolve in our blood in hemoglobin, and then heart pump out this oxygen to the each and every cell of our body. So if the anemia and heart failure both coexist in a person, then the symptoms will be very more. The patient will be very symptomatic. So there may be not be direct link, but this symptom will increase if both coexist. At the same time, severe anemia can cause heart failure itself. So patient we call this secondary heart failure because of the anemia. So anemia can cause heart failure, and at the same time, some patient with the heart failure, because heart failure is a chronic disease, long-term disease. So because of the long-term illness, many patients with heart failure have associated anemia also because of the chronic disease. So if the patient has a heart failure and anemia, we should treat anemia as well as heart failure both. Because both are doing the same thing. They are delivering oxygen to our body in each and every cell of the body.
All right. Now, Dr. Mayur, can diabetes affect a person's memory and cause other cognitive disorders? If you could tell us a bit about that.
Okay, so that's a tough question. And yes, there is evidence that diabetes can affect, in fact, dementia, and especially Alzheimer's disease is more common in uncontrolled diabetes. Also, depression is seen in diabetic patients, and uncontrolled diabetes can have vascular dementia also. There are microinfarcts at vessels which are there in brain. They are clotted. Okay, there is damage in that, and then it can cause dementia. Also, now the ADA, that is American Diabetes Association, guideline says that we need to screen for cognitive impairment for all diabetics who are above 65 years. And we have evidence that uncontrolled diabetes can lead to cognitive impairment, but reverse, we don't know that whether very good glycemic control can prevent this. So that still is not very well proven in studies. But yes, if there is cognitive impairment, then the management of that diabetic patient changes. So definitely we do screen patients for the cognitive impairment.
Right. Now, Dr. Beniwal, are both the heart failure and heart attack the same, and which is a more serious condition?
Very, very, very important question, sir. Many patients confused with these terms. Heart attack is an emergency condition. Heart attack means there are suddenly hampering of the blood supply to the our heart. Heart is supplying blood to the whole body, and it needs itself needs blood to work on. So, if there are three arteries which supplying blood to the heart, if by any means, most commonly thrombus, suddenly there is a decrease in the blood supply to the heart, this condition is called a heart attack. It means not sufficient blood going to the heart. So, heart attack is an emergency condition, and it should be treated as early as possible. Every minute counts in this setting. So, it is an emergency condition. Heart failure means our heart, due to the various reasons, is not able to pump sufficient blood for our demand of the body. So, this is heart failure. The cause of the heart failure may be heart attack, because the heart becomes so weak that it could not pump out sufficient blood. Other than the heart attack, other cause like hypertension also can cause heart failure. Valvular heart disease itself can cause heart failure. So, heart failure can be acute and chronic. There are two conditions. Acute means patient suddenly deteriorated, and chronic means patient having a heart failure, but because of some lifestyle measures and because of some drugs, he is able to maintain his life. So, heart failure has acute and chronic phases. Heart attack is always an emergency condition. About the seriousness, both are serious. Heart attack is an emergency seriousness, and we have to treat immediately. Heart failure is a slightly chronic disease, but prognosis is not, the severity is high, and prognosis is not very good. Even the prognosis is bad than the many of cancers we know. So, with the recent advancement in technology or improvement in diagnosis, both the heart attack and heart failure are treatable, and the patients are living their life after these diseases very worthfully and meaningfully.
All right, and Doctor, very briefly, if you could tell us, why are we seeing, or at least it seems these days that younger people are having heart problems and having heart attacks?
The reason may be various. One reason is there is a proper diagnosis available, so that we can diagnose these patients early. So diagnosis is more, so we can diagnose this disease in early phase also. Second thing which is very important is that in Indian subpopulation are more prone to heart disease than the Western population. In Indians, heart attack comes 10 years earlier in life than the Western population. So we are more prone to heart attack and diabetes both. And third thing is lifestyle is very important thing. Most important factor for causing heart attack in young is the smoking. Tobacco use in any means, either by smoke or by chewing, it is a very important cause of the heart attack in younger population. Other than the smoking, the physical inactivity, obesity, junk foods, they all are causes of the heart attack in the young.
All right, so I think the underlying message from both doctors is, to lead a healthier lifestyle and, of course, go in for regular checkups after the age of 40. Thank you so much, doctors, for joining us on the program. And thank you all for watching at home. Goodbye.